This is Lolly Gardiner. I've been with MRIGlobal 24 years, originally working there in the Kansas City office in the biosafety, biotechnology section, which I think has not existed in quite a while. But I worked in the BSL-3 there and then became the biosafety officer for Kansas City and then moved out to Maryland to work in their global capability department. So that's me, Sharon.
Thank you, Lolly. Hi, thank you all very much for joining. So this is Sharon. I've been with the company a little more than 8 years now, brought on board initially to support international laboratory capacity building efforts in Kazakhstan. I was heavily involved in Ebola work, both during and post-pandemic, supported a BSL-4 contract that we had out here in Maryland for a while, and have subsequently been involved in anything from the work we're going to be talking about here today with more of the biosafety end of things to helping stand up the CLIA laboratory here in Maryland. So with that, I think Lolly, if you would like to get us started.
Yes, thank you. Thank you. Yeah, I also want to thank everybody for joining us on this back to campus for area schools during the COVID-19 pandemic. As we all are aware, the spring of 2020, just about a year ago, a little over a year ago, schools in the United States and around the world closed their doors and had children stay home. Many of those children were on spring break and had a year-long spring break. Some of them got back in the fall. But our group here at MRIGlobal, we helped 6 area schools almost from the beginning start to prepare to get their students back on campus. We helped 4 universities, a high school, and a pre-K to kindergarten school. Some of these you may be familiar with. They are in the neighborhood of MRIGlobal there in Kansas City. So some of you might have children that actually go to them. We started off working with William Jewell. They really brought to us a problem and wanted a solution. Luckily, Sharon, Scott, and I, who have been doing biosafety for many clients for many years, we generally we generally help people get their programs started and developed. So it was a really natural fit for us to take the schools and learn about their programs and then incorporate biosafety aspects into getting their kids back on campus. So what we did originally was ask that each of the schools provide us with any type of emergency response or any type of COVID response they currently had in place. Some of our schools did have emergency response plans, not specific to COVID, but a lot of universities have to be aware of things that happen on their campus for public health concerns. So they had some type of documentation to get started on. With our primary schools, they generally did not have emergency response plans. So we either helped update emergency response plans or wrote emergency response plans for some of our schools. And really what we did was took a broader look on infectious disease around settings of schools and built them an emergency response plan that not only addressed what they were currently dealing with, but what they could use going on into the future if something like this would happen again. Even if it was something as simple as a flu outbreak, they would now be able to have documentation on how to proceed. Once we gathered all of their emergency response, we put it into a campus response matrix, and we're going to look at that here in a minute. And the campus response matrix was really like a piece that allowed every single person in the school to know how to respond under different situations in relationship to COVID-19 or SARS-CoV-2. From those that are serving lunch to those that are cleaning the bathrooms. It really laid out a plan on different levels so they would know exactly what would be expected of them. And then we kind of finished up our work with these schools by delivering training and information sessions to their students, employees, faculty, parents. We did over 19 events on training and information sessions for these 6 schools. And we reached over 17,000 people during that process. So this is just kind of a timeline of how we kicked off the project, and then just how we worked to deliver. You'll see that there's a lot of times where things overlay. We'll start reviewing emergency response plans and start working on the matrix kind of simultaneously there.
Yeah, and this was a collaborative effort. So, you know, as much as possible, we would work with the task force at these schools, to really get not only their buy-in, but help them develop a sense of ownership of the material we're putting together. Because once we walk away, they're the ones who had to implement this. They're the ones who had to explain it and reinforce it with their key stakeholders and their students and their employees. So, a lot of this, in many cases, they may have, initially asked us to be the ones to develop exactly what they're supposed to do. But really, in the end, it was a collaborative effort. So when we put together trainings, we made sure that their task force had a chance to look at it, that their task force had representatives there who were part of the presentation to show that they were engaged in this process, and put them in front of whether it was the students, whether it was their teachers, whether it was their employees, show them as the authorities on this, that it wasn't just these outside consultants that they had brought in who would walk away and leave the vacuum. So, and it was an iterative process as well. As we got feedback during the process, as we held early training events and heard the questions and concerns people still had about things, we would look to ways to incorporate mitigation strategies to address those issues, so that the next round of training, the next version of the matrix, addressed those concerns, to make sure that it really was some living, breathing documents that really felt the need or met the need of those particular communities.
Yeah, if you want to scroll over, we'll give you a little peek on how we worked out this matrix. We spent lots of time with different areas around the campuses to interview those people that worked in those areas, and to understand what they did for what their job entailed, and if there was a biosafety component to that we needed to address. We arranged the protocols and procedures according to mostly what the Kansas City Public Health Department had put out as their different levels of response. So level 1 through 4, 1 being kind of like new normal. Prior to getting the vaccine into place, you'll see that this data has not actually been updated since we've all been vaccinated now. So this is, was put together last December. But the levels coincided with what was going on in the community also. So if you were at level 2 in the community, level 2 on campus would correspond with that, and then the level 2 would give you kind of what that department should be doing at that time. So level 1, the baseline. Level 2, going up, no active cases in the community or on campus. Level 2, that might be some cases in the county or on the campus or in the city, and then on from there. Each campus we put this together for each campus, so they they're the ones that really gave us the parameters around what they felt was a risk tolerance that they could really take on for the campus. Some of our campuses were really conservative, and 1 or 2 cases would trigger everybody staying home. Some of our campus were a little bit more liberal with that, and because of the maybe the facilities they had were able to handle more cases on their campus, so their risk tolerance was a little bit different. A lot of our schools actually still post this. They use it to let their administrators, faculty, students, and staff know what status they're in. One of our universities has a flagpole on their campus where they put up different colored flags to let the campus know what level they are in.
Yeah.
Sharon, did you want to add anything about?
Yeah, and I did want to, kind of reemphasize the importance that we placed on, the risk tolerance of the school community. Has, a lot of what these schools were looking for naturally was what is the number of cases we should have before we shut something down? What is the exact conditions? And as I'm sure you can all appreciate, that's a very difficult question to answer because it's going to depend on a lot on what your students think is appropriate, what your parents think are appropriate, what your teachers think are appropriate, and that really did vary considerably between the campuses. So we had some campuses where we had worked everything out and come up with levels, and then as soon as the first two cases were reported to the school, it's became very apparent that the teacher's tolerance for risk was much, much lower than the administration had appreciated. And so they ended up reevaluating, reassessing their matrix and changing their parameters and being more reactive sooner when there were cases present in order for the teachers to feel safe being back in the workplace. So we definitely tried to encourage them and enable them and give them the tools to have that sort of adjustment, those course corrections, in order to make sure that their community, their internal community, felt as safe as possible.
We found as we started to move through helping the schools that we needed to put in an optional task 4, which was really an on-call task where people, our contacts that we were working with sometimes would just have questions that would come up kind of out of the blue. Maybe something happened in the news that they would like more clarification on. Or in some cases, there would be an incident on campus and they wouldn't quite know how to handle the cleanup and kind of managing that situation. So we did have an on-call, emergency on-call consulting task where our clients could just give us a call and we would walk them through whatever situation related to COVID they may be facing.
This was, a good way for their leadership to feel like they had the support they needed while still being seen as the front runners, the people in charge of the effort there. So I think it really helped bolster their confidence that they could manage these situations as they came up. And that they did have the tools available to them and that they were able to serve their community in the capacity that they wanted to and needed to. So, as those those consulting agreements progressed more and more, they would come to us and say, hey, this is what we'd like to do, or this is the situation, this is what we'd like to do. We just wanted to make sure that we're thinking of things the right way. They just were looking more for that stamp of approval at the end, more so than we really don't have a clue. So there was very much this natural progression from them really looking for, don't want to say hand-holding, but for that real distinct guidance to them, more looking for just a cross-check to make sure that they were on the right path, that they were using the right resources, that they were interpreting things in an appropriate manner.
Very true, yes. And we actually just used this option again beginning of March when one of our universities wanted to have some staff come out and take a look at their campus before they got all of their students back in person full time for the summer. So it's worked out nice. I think I said earlier that we reached over 17,000 people. Maybe that's what I felt like we reached. But when you look at all 6 schools that we helped, we reached over 7,000 people in the Kansas City area and talked to them about COVID, SARS-CoV-2, biosafety. So I think that's a pretty good accomplishment. 7,000 more people know about biosafety, which always makes me happy to talk about biosafety. So